Charming. Pet guru. Black spots on cat's gums. Should you take action in 2024? Taking good care of my beloved cat is really important to me. I make sure to pay special attention to things like my cat's teeth and gums because it's a big part of keeping them happy and healthy. Lately, I noticed some worrying black spots on my cat's gums, and it made me feel concerned and curious about what might be going on. Even though I'm not an expert in veterinary stuff, I decided to learn more about these mysterious black spots. I wanted to figure out what they could mean. I realized that, as cat owners, it's super important for us to understand that getting advice from a vet is the best thing to do. They're the experts and can give us accurate and reliable guidance. The idea that these black spots might be a sign of something important not only made me more worried but also made me realize how crucial it is to take action quickly about black spots on cats' gums. Now that I know more and understand the signs, I feel more in control and ready to do things to keep my cat safe and healthy. It's a reminder for all cat owners to keep an eye out, stay informed, and make our furry friends' health a top priority. Signs of black spots on cats' gums. Number 1. Dental resorption. When it comes to dental resorption, I've learned that it's a condition where a cat's body starts breaking down and absorbing its own tooth structure. It's not a pleasant experience for them, and it can even lead to changes in gum color, like those black spots. The pain can get pretty intense, and sometimes, the vet might need to extract affected teeth. That's why I make it a point to ensure my cat gets those regular dental checkups. Catching dental resorption early on is crucial for their well-being. Number 2. Exposure to toxins. Now, on the topic of toxins, I'm aware that cats can accidentally get in touch with harmful stuff in their environment. Whether it's certain plants, household chemicals, or who knows what else, these toxins might cause changes in gum color, including those worrying black spots. If I ever suspect my cat has ingested something harmful, I don't waste a moment. I head straight to the vet for their expert opinion. Number 3. Systemic conditions. Then there's the possibility of black spots on the gums indicating bigger health issues. Conditions like kidney disease or autoimmune disorders could be affecting my cat's overall health and showing symptoms in their mouth. To get to the bottom of such systemic problems, I know a comprehensive vet examination and diagnostic tests are essential. I want to make sure I'm doing everything possible to manage any underlying health issues my cat might be facing. Number 4. Age-related changes. As cats age, it's natural for them to undergo changes, and one common change I've noticed is in their gum pigmentation. It's not unusual for older cats to develop darker spots on their gums. While these changes are typically harmless, I make sure to monitor my cat's overall health closely as they grow older. If I notice anything concerning, particularly in their mouth, I don't hesitate to inform my vet about any unusual developments. It's important to keep in mind that every cat is different, and the reasons behind dark spots on the gums can vary. If I spot any alterations in my cat's oral health, behavior, or general well-being, I understand the importance of seeking advice from a vet without delay. Detecting issues early and taking action can greatly impact the effectiveness of treatment and my cat's overall health and happiness. Therefore, I prioritize regular dental care, a well-rounded diet, and remaining vigilant for any abnormalities as essential aspects of being a responsible cat owner. Additionally, have you considered the significance of changes in your cat's eye size? Discover more about cat eye health here. What does it mean when a cat's gums are black? If my cat has orange fur, black gums are usually nothing to worry about. Like we talked about earlier, orange cats often end up with these little freckles called lentigo simplex, and that's what makes their gums look black. But for cats with different fur colors, black gums might need more attention. I should keep an eye out if my cat's gums start looking yellow or blue because that might signal a problem with the liver or not getting enough oxygen. There could be other reasons, too, such as gums getting stained for a little while, bleeding because of an injury, issues with the teeth and gums. If it's about the teeth and gums, my cat might be in pain and might not feel like eating or drinking. That's a clear sign that something might be up. Lentigo simplex. Lentigo simplex is this thing that can run in families, causing black spots and freckles to appear on my cat's gums. Those freckles go by the fancy name lentiginous, plural for lentigo. These spots can also pop up on and around my cat's nose and lips. If I see these along with black gums, it's a good bet it's lentigo simplex. My cat doesn't need to sport pure orange fur to get hit by this. Even tortoiseshell and calico cats can have these symptoms, and cream or silver-colored cats might have this harmless condition. The reason cats with these colors are more likely to get it involves melanocytes, these cells that give a cat's fur its color. Orange fur has a slightly wobblier genetic code, so sometimes the melanocyte decides to go back to its default black shade. I can't really prevent lentigo simplex, but at least it doesn't get worse from sunlight or other outside things. If my cat has the genes for it, those black freckles will pop up. Usually, this happens later in life, so I might notice it more as my cat gets older. And, here's the deal, those freckles aren't cancerous. They won't bug my cat with itching or pain. Still, it's smart to learn how to tell the difference between lentigo simplex and bumps that could be cancer. Concerns about my cat's gums being black. Number 1, cancerous cells. If those freckles are poking up and my cat seems uneasy, they might be cancerous. Number 2, gum staining. My cat's gums might get stained for a bit. It's not a long-term issue, but it's not something I should ignore. Whatever caused the staining could attract bacteria, leading to gum disease. I need to think about whether the staining might be from food. This is rare because good cat food isn't black. Dry food can sometimes make a paste on the roof of the mouth, but it's hardly ever black. If the staining isn't from my cat's food, I should check for signs of poisoning. Like, did my cat lick engine oil from the garage floor? Symptoms of poisoning include vomiting and diarrhea, low body temperature, muscle tremors, difficulty breathing, foaming at the mouth. And then there's the possibility my cat drank water that wasn't clean. Cats prefer the natural stuff, so my cat might have sipped some dirty water from a plant pot or puddle outside. This leaves my cat at risk of infections, including leptospirosis, giardiasis, toxoplasmosis, lungworm. If my cat's got stained gums, it's a good idea to brush my cat's teeth and clean its mouth. Number 3, cleaning my cat's mouth. If I need to clean my cat's mouth, I'll need a soft toothbrush, cat-friendly toothpaste. I'll have to keep my cat still while I brush its teeth and gums. Most cats won't like it, so wearing gloves can protect me. After I'm done, I'll encourage my cat to drink water. Number 4, bleeding in the mouth. If my cat's mouth is bleeding inside, it could be because of a head injury. Cats are sneaky about hiding signs of injury, so I might not catch it right away. The blood might have dried up and turned black, making it look pretty noticeable. I should check for any signs of bleeding on the outside. If I don't see any, I'll need to keep an eye on my cat's behavior. Warning signs of a head injury include not being able to coordinate well, twitching and seizures, ignoring things that usually get a reaction, swelling around the face, sleeping a lot more than usual. Getting x-rays and scans for my cat is a good move to see how much damage there might be. If there's no sign of a head injury, I need to think about other reasons for the bleeding inside the mouth. Sores and ulcers. Blood not clotting well. A tooth getting absorbed into the gum. Side effects from medication. Maybe even mouth cancer. Number 5, gum disease. Gum disease, periodontal disease, is something a lot of cats 3 years and older go through. It's not fun and can be connected to other health issues. According to veterinary immunology and immunopathology, it can even lead to feline calicivirus (FCV), feline leukemia virus (FALV), and feline immunodeficiency virus (FIV). Keeping my cat's teeth in check with regular brushing can help steer clear of gum disease. Signs that my cat might be dealing with gum disease include breath that's not so fresh, gums that are bright red and swollen, swelling around the face and mouth, my cat rubbing its mouth, drooling more than usual, saying no to food. If my cat's gums look black, it might be a mix of dried blood and tartar spreading. Gum disease kicks off with gingivitis, which can be turned around if I catch it early. If I let it slide, it could turn into stomatitis, a fancy word for gum inflammation. Number 6, gingivitis. Gingivitis marks the beginning of gum disease and can arise from inadequate oral care, infections, or stress. A major culprit is food particles lingering between or beneath the teeth, especially with soft food. Initially, plaque is transparent but darkens over time, eventually hardening into tartar, which gives the gums a black appearance. Early detection of gingivitis allows for effective reversal. Consistently brushing my cat's teeth or opting for professional cleanings can combat gingivitis. Being vigilant for symptoms and considering professional cleaning if brushing is challenging is a wise approach. It's important to note that older cats may pose a slight risk under anesthesia during such procedures. Treatment of black spots on cats' gums. Certainly, let's dive into some more details about treating those black spots on my cat's gums. Number 1, anti-inflammatory medications. If my cat's gums are inflamed and contributing to those black spots, my vet might prescribe anti-inflammatory medications. These meds work to bring down the swelling and make my cat more comfortable, which is key for a quicker recovery. Number 2, antibiotics. If there's any sign of infection hanging around those black spots, the vet could recommend antibiotics. This helps tackle any bacterial issues and prevents the infection from spreading elsewhere in my cat's mouth or body. Number 3, nutritional supplements. Depending on what the vet diagnoses, they might suggest nutritional supplements to give my cat's overall health a boost. This is especially important for conditions like kidney disease, where tweaking the diet can really make a difference. Number 4, behavioral and environmental changes. If there's a suspicion that my cat got into something toxic, the vet might guide me on changing up the environment. That could mean saying goodbye to certain plants, securing household chemicals, or making other adjustments to prevent any more toxic encounters. Number 5, home care instructions. As a cat owner, I'd likely get some detailed instructions for at-home care. This could involve pointers on giving medications, incorporating dental care practices, and keeping a close eye on my cat for any signs of discomfort or changes. Number 6, ongoing monitoring. Regular checkups are a must for keeping tabs on my cat's ongoing oral health. These visits let the vet track progress, spot any potential comeback of those black spots, and tweak the treatment plan if needed. Number 7, dietary modifications. If those black spots are linked to broader health issues, the vet might suggest adjusting my cat's diet. This could mean a prescription diet tailored to tackle specific health concerns and keep my cat's overall well-being in check. Number 8, collaboration with specialists. In trickier cases, or if there's a link to systemic disorders, my vet might team up with specialists like veterinary dentists, internal medicine experts, or nutritionists. It's all about making sure my cat gets comprehensive and specialized care. Number 9, educational guidance for cat owners. Vets aren't just there for treatment, they're educators too. They often share info on preventive measures, signs to watch out for, and steps to take in case of emergencies. It's all about empowering me to be an active participant in my cat's healthcare. So, success in treating those black spots boils down to catching things early, nailing an accurate diagnosis, and teaming up with my vet. Keeping the lines of communication open, sticking to the treatment plans, and being proactive with preventive care, it's all part of the recipe for ensuring my cat's long-term health and happiness. Conclusion. In conclusion, black spots on a cat's gums may have various causes, from harmless freckles in certain fur colors to potential indicators of health issues. While lentigo simplex is common in orange cats, changes in gum color in cats of other hues warrant attention. Regular veterinary checkups, proper dental care, and vigilant monitoring of overall feline health are crucial. If concerned about black spots or changes in a cat's gums, consulting with a veterinarian ensures accurate diagnosis and appropriate care, contributing to the long-term well-being of our feline companions. For more information on related topics, explore our articles on dealing with cat poop issues.